Greetings, everyone. This is Timothy Youngs, the Digital Apothecary, and today I'm giving you guys a rundown of the latest studies that I've come across in the digital health space this past week. So this is obviously running a little earlier than I typically run it just because I'm going to be out at the ASHP mid-year next week giving a presentation and hopefully meeting some people and networking with others in the pharmacy space who are interested in technology. But in any event, so what do we got this week? We actually have more studies than we did last week. As you noticed, last week I talked more about some white papers that are out that I still think are relatively interesting. So if you haven't read them, go back and look at them, especially one on digital therapeutics from the Digital Therapeutics Alliance and also AMA's playbook on remote patient monitoring and digital health. So what do we got? Well, first I'm going to start with two reviews that I saw that, I think they're pretty important, but it's more specialized depending on your therapeutic area of interest. So the first one was published in the European Respiratory Journal, and this is more like a review, kind of a viewpoint on where pulmonary medicine is going with sensors enabled for inhalers and such. And that's one I would say if you're interested in polyspace and also interested in sensor-based adherence technology, it's probably a good worth read. It's a little niche there. The next one is from Clinical Pharmacology and Therapeutics. This is really a fascinating review. I would highly recommend it if you are involved in clinical trial design or if you're in pharma and looking at how do we contemplate digital biomarkers or different means of measuring different items in patients' lives, especially in clinical trials using digital health technologies. So I would definitely give this one a read because I think it's one that stands out to most of me regarding that and one of the better ones I've seen lately written. Now, the next four are some clinical trials. Some of them are bigger than others, but I think they're all worth talking about. So the first one is from AJHP, and this one was about using technology to enhance medication education for those that have just undergone solid organ transplant. And as you know, they have very complicated and very dynamic medication regimens just because they're, it's a complicated disease management system. So how do we deliver the best manner of care for these patients and educate them on a very diverse medication regimen that takes a lot of monitoring and takes a lot of amount of adherence for them? So what they did was they actually used these tablet-based devices, and this is made by Tonic Solutions, so you may have heard of it in the past, and they make a lot of interesting technology for this types of tablet-based entering data. And what they did was they had 282 patients from 2015 to 2017. And what happened is it was almost like a branch logic reasoning where if you had this medication that you were entered on, you would watch these videos, you would do questions on them, and from the questions, then the pharmacist could gauge how well the patient knew about the medication. So for instance, if you had like a 4-hour window for medication and you missed it, what would you do? What things to take, what things to add. And in this case, what they found was the pharmacist doing this saved a lot of time for them because then they could identify patients that maybe needed more education in certain areas or more touch points than they were getting previously. So I'm getting to the point where I believe a lot of this technology helps the scalability level, where instead of just giving a blanket statement, a blanket approach for every patient, by using especially these tablet-based questionnaires with videos and games that you can do, you can say, okay, this patient is actually doing pretty good. They're meeting our baseline. They don't need that much intervention versus we've done this with this patient. It's not working. So we need to have more touch points, et cetera, et cetera, et cetera. And I think we're getting a lot of good literature stating this, and I really like it. And this is a good one that hits close to me as a pharmacist because I can really see this stuff being used by the bedside, or where I think it should also go is in the community pharmacies at some point, just because, a patient there's for a 15-minute wait. Why can't they do something similarly? These videos were set up for 10 minutes as well. So I think it's quite feasible, and I think that's something that we should look into next. Next one is from American Journal of Preventive Medicine. This one was targeting obesity and weight loss and worked at a community center. It was a 12-month RCT in 351 patients that were randomly assigned to a traditional intervention group for weight management, and along with a digital intervention that worked through an AHR for recommendations on health that use like a smart scale, use questionnaires and such, and helping patients to identify how to lose weight and be more healthy. These patients all had either were obese, had hypertension, diabetes, and hyperlipidemia. And what they found was that at 6 months and 12 months that the intervention group was having a greater weight loss of almost 5% overall. So I think that's a very good thing to see here, and I think it's going to give more credence for a lot of the literature in terms of trying to see how can we use these apps and different platforms for weight loss. Next one is trends in telemedicine use in large commercially insured population. So this is not really so much a study as much as a data review. It is a research note published in JAMA this week, and I've seen a lot of press about it. It's really very interesting. And what it goes into is it was looking as a post analysis of Optum Labs data from 2005 to 2017 at who was using telemedicine services. And the authors actually thought they might see like an increase in use, and what they found was it really hasn't had that high of an uptake. Rather, the use of telemedicine for over these 12 years is relatively still low and uncommon. But some interesting demographics to pull out that, or I think a lot of people are highlighting, is it was an urban population. Almost over 80% of the use was coming from urban population, which kind of goes against the whole theme of telemedicine and a lot of digital health scalability. Is we want to use it for rural populations because they have probably the biggest logistic risk of seeing someone. So, it's kind of counterintuitive seeing that this is coming from an urban population. Population also was younger and female. And the two common uses was telemental services and primary services. So, take that for what you will, but this is still some data that I think is kind of shocking to see for those that are really trying to embrace telemedicine and what's its role. I'm hoping we see some other data from other places that either show that this is very similar nationwide, or maybe there's different interventions people have done to see a better uptake. The last one is from JACC, and it's in their clinical electrophysiology subset journal. And this one's basically about smartwatches used for atrial fibrillation detection. It was done in 508 subjects that were given a smartwatch that using pulse wave measurements, and also at the same time using ECG for monitoring for atrial fibrillation. And it's another study that's relatively interesting because it's showing that there is some good specificity and sensitivity for measurement to detect atrial fibrillation. The only big thing, though, that the authors noted, and I will admit I've not read this one because I can't get it, so I'm going based on the abstract here. If someone can get it and get more detail, that'd be great. But they were saying there was a high dropout that really limited the study's implications. And I can't really tell from the abstract what that dropout was due to. I'd be really curious about, because that's kind of like the big thing that's going to be linchpin here, especially when we hear about Apple wanting to get into using the Apple Watch for atrial fibrillation detection. Why do we see this dropout occurring in here? And the other thing I don't know is I don't know what watch it was being used here as well. So in any event, this is a rundown of the studies for the week of November 26th about digital health. Looking at your thoughts, and if you have any recommendations how to improve this, or if you enjoyed it, please feel free to let me know. Take care and have a good day.